Hello, I'm Steve Rochester. I'm the Senior Resource Officer for East Sussex Healthcare NHS Trust. This is a short introduction to the role of the FY1 at a cardiac arrest. Also, you'll be shown a YouTube clip that shows how to run a cardiac arrest as per G 2015 guidelines. I now want to show you how to open the cardiac arrest trolley. The cardiac arrest trolley has a yellow tag at the bottom of the trolley. The tag needs to be broken. Then lift the flap up and push it all the way home. That enables the drawers to open. If the flap is not all the way seated, the drawers will not open. Another part of the cardiac arrest equipment is how to apply the defib pads using the Philips MRX defib. The black therapy cable has a test load adapter. Remove the test load adapter. The defib pads should be within the first drawer, if they're not, on the top. The defib pads will come in a packet thus. Once you've opened the pads, there is a cable with a connector. The connector plugs into the long black therapy cable. It will only fit one way. If it is upside down, it won't fit. Once the pads are attached, connect them to the patient's bare chest as per the diagram.
As part of your on-call, you'll be expected to attend crash calls when you're on ward cover, which is second on-call. At the start of your shift, remember to collect your cardiac arrest bleep from the medical assessment unit. And if the bleep goes off, listen to the instructions. Find out where the patient is and start to make your way there. If you arrive and the patient has not arrived yet, for instance in A&E by ambulance, start to get the equipment ready and introduce yourself to the rest of the team. If the cardiac arrest is at any other part of the hospital, start to make your way there. You might be the first doctor to arrive. Start your assessment and ask for help from the other members of staff available on the ward. They're there to help you. As an F1, your role can vary depending on the cardiac arrest call that you attend. Sometimes you're expected to get access and send off bloods. This is very important. Make sure that you're sending off the correct investigations, and it is up to you now to label them correctly and make sure they reach the lab. And if you need to request blood gases, remember that there are sheets with barcodes mounted next to blood gas machines that you can use to obtain the results if you don't know the details of the patient. This means that you can get the results quickly and then you can link the results for the blood tests back to the patient at a later date. Your first cardiac arrest call can be quite frightening, but you work as part of a team and you're not expected to do it all by yourself. And remember, at the end of your on-call shift, to return the cardiac arrest bleep before you leave. You also have training as part of the ILS course during your shadowing week before you start your F1 job.